see here. You should take, oh, and there we are. We are live. Welcome, ladies. It's Amy from Fit and Fierce, and this is our Expert Talk series. And I just have to tell you, I love interviewing all these, whoops, I should turn off my phone. Give me 1 second. There we go. Click. And I do love doing these Expert Talks because it's such great information for all of us. And I want to share my next guest here, and it's Lindsay Keefe. And I met her through we just called her the Powerhouse networking queen, Bonnie Chan, who I also interviewed last week on mindset coaching. So, and this is her good friend, Lindsay Keefe, and she is a yoga therapist, right? Mm-hmm. I had no idea that there was such a thing as a yoga therapist until Bonnie introduced me to Lindsay, and I had gone to see her a couple of times for some, back issues, I think, or shoulder issues. And here's Lindsay Keefe. Hi, Lindsay.
Thank you for having me. This is exciting.
So do you want to tell me a little bit about yoga, being a yoga therapist, or the difference between a yoga, or what is a yoga therapist? Let's start there, because when I first heard that, I was like, what is that? My brain was all fired up, and I couldn't wait to meet you and find out what yoga therapy was.
Yeah, so yoga therapy, it's a lot to unpack, but it's very simple at the same time. So people hear the word yoga and they think yoga teacher. It's a slightly different set of skills, so I can go into a little bit of the difference after. But as a yoga therapist, I'm essentially a movement therapist. So if you get kind of hung up on the idea of yoga, you can just kind of set that aside a little bit. But essentially, I work with people one-on-one who are experiencing, pain, persistent pain, or a lot of stress. So when I meet with someone, we go through, we chat a little bit beforehand to see if we're a good match and if yoga therapy is right for them. But really what I do is we go through an in-depth assessment and intake where I learn about, the physical issues and concerns and, what other desires do you have in your life? What are your hopes? What are your dreams? What are your goals? So I really want to get to know what has and hasn't worked for you in the past, your strengths and the outcomes that you want. And then I take the time to really listen to your story. There's so much great stuff that comes out when we just have a conversation that maybe doesn't get to be said when you work with your doctor or some other healthcare practitioners. And I've also been trained to have a really keen eye for movement. I can see the nuances of movement, how we compensate or make up for limitations that are existing in our bodies. So we typically start with movement, and movement isn't always what happens depending on the person and their needs. So I assess and evaluate as we go along. And so I'm watching and we're chatting, I'm getting feedback from the client about what they're experiencing. And helping them to, grow their awareness around how their body moves and what they're experiencing and whether that's supportive or not supportive. And so growing awareness around their patterns, whether it's movement patterns or things that are showing up in their life, is really, really key to progress and healing the issue. And what it really comes down to is, every person is, really unique in their expression of their movements, in their beliefs, their life experiences, their lifestyles. So, really getting to know the person in the context of their whole life is really, really important because we can't treat every person the same way. Mm-hmm. I could see, 10 people who are experiencing back pain, but I wouldn't provide, a template or a protocol to resolving back pain because each person will experience it in a completely different way and have a different way of being able to move and work with their issue. So throughout the session, we explore some movement, we might explore some breathing, some meditation, whatever is appropriate for them. And then they come away with a written out home program so they can continue to progress and build on the gains that they've experienced within the session.
Right. I love it. And you're right. It is. And it's a really good opportunity to learn about your body and how it's moving. That's what I realized. And you're right. You do have a good eye, because I'd be like, the slightest little move and Lindsay be like, no, this way or that way. Right. And you're thinking okay, what does she mean? And trying to make these little adjustments. And I do find that is a different way of treating some potential chronic issues that you may have, because if you have seen other modalities or other therapists like massage or chiro and whatever, I find that although they are good and they do fix the problem, it doesn't it doesn't get to the root of the problem.
Yeah. So we're really about, resolving the underlying issues that are creating the problem to begin with. So we don't apply a Band-Aid while it might be a little bit of, working through some coping strategies to manage the pain at first.
Mm-hmm.
Eventually we were working towards how can we resolve these issues so you don't have to experience the pain in the first place. And there's a process that we go through to get there.
Right.
And then oftentimes people kind of start to see possibility through new eyes and they're like, oh, I didn't realize this was possible for me. Now there's something else available, and I get to help them with that. So maybe it's, another goal that we can break down and work towards that has nothing to do with pain management anymore because this new exciting possibility has developed.
Yes, yes, yes. Yeah, because I find that when I go see the other practitioners, although I do find it helpful, you're not being told what's actually happening. You're not learning anything. You're just being adjusted or massaged or whatever, and you don't really understand the problem other than the fact that you know it. Or when I go see a yoga therapist like yourself, when I saw you those few times that I did, I noticed it's like you're learning about your body and how it's moving and and understanding your patterns and learning how to change them, right? Because I realized that my left shoulder is different than my right shoulder, and how is it different? I'm anteriorly rotated. My serratus is weak, and and you were trying to make them. I think I overanalyzed. That's what happened.
Yeah, you're really, really in your head, and you're like, okay, what do I need to engage? How do I need to move this? And when our body moves, when it's moving well, the muscles will engage just to do the movement. So it's just, okay, this is the movement, and we're just going to move in a range that the body can do it without having to overthink it. Yeah.
So that. I was like, wait a minute. Oh yeah, that's right. I was totally overthinking being the trainer that I am. I was like, okay, what do you mean? Like, what does that mean? What muscle is she trying to get me engaged?
Yeah. So we try to rely on just feeling and not thinking our way through feeling. So there's a lot of discernment, and sometimes it can be a little bit frustrating, but it's really not about making the client wrong or feeling like the body's broken or not working. Like, our bodies are perfect just the way they are. And then we can refine and we can learn more and we can become aware of more.
Right.
And as we start to feel more empowered and understanding, like, this is how my body is doing today, and working with that.
Right. Yes. Now tell me, for women over 40, what do women over 40 come to you for typically?
So there's so many things. So a lot of people come to see me because they have like persistent or chronic pain. But two of the main things that I would say would be pelvic health. So women who have concerns about incontinence, prolapse, pelvic pain, like those things can really like limit our quality of life. And they're common, right? Like, a lot of people experience those issues, but it doesn't mean that they're normal. And as we bring our awareness and our attention to some of the structures in and around the pelvic floor, we can start to unravel some of the things that are, holding us back. And so we can resolve those issues, fairly quickly. It just requires a little bit of consistency and a little bit of practice and willingness to, feel.
Right. Right. And so pelvic, and what would be like a number two?
Yes. So the number two would probably be low back and hip pain. And that's probably paired with neck and shoulder pain. So it's either neck and shoulder pain or hip and back pain, or sometimes it's both.
Mm-hmm.
Definitely I've been through both. Sometimes at the same time, sometimes not at the same time. But usually one or the other.
Right.
And so that can be another thing that's, greatly limiting to our quality of life. We find that we can't exercise or be as active as we were, or in a different way. Recovery might feel like it takes a lot longer. And our hip and backs are so key to, longevity and, having good energy and feeling well and aging well. So, see a lot of people for those issues. Yeah.
Yes, that's my key thing, is aging well and being active. Like, being active for me is my entire life, right? So if I can't, and I noticed that I turned 50 last year, and I realized that I'm still learning about my body. that's what I realized, right? It's like at 50, I'm still trying to figure out the little things that I'm having issues with. It's like, why is this happening, right? And just trying to understand why my shoulder, or I'm getting, everything that happens to me is on the left side, never on the right side. Right? That's a big one for me. And then having neck and shoulder pain for sure. And I feel like I'm getting, like I'm realizing I'm having like weak neck muscles. I think it's from all the whiplashes that I've had over the years,
Mm-hmm.
and trying to figure out like what it is that I need to do, right? And I think I might need to come back and see you there, Lindsay.
Well, the great thing is I'm doing online sessions now. So thanks to Zoom, I can, see you and we can do much of the same practice. We obviously don't have the hands-on part, but I'm pretty good at describing what needs to be done. So
Right. And I totally understand that because I've been teaching classes online with a bunch of ladies. And I was a little bit nervous at first because I was like, well, what if I can't see them? But, if the person has their laptop or their phone in such a way that you can see their entire body, I can actually correct them quite easily from a distance. So
yeah.
I'm back there and my laptop is over here. I can actually see exactly what's going on. So I believe that you can make adjustments over Zoom. But I did enjoy coming to your studio on Queen Street here. Just because it was a beautiful studio with lots of wood paneling and beautiful light coming in and all the toys that you had in there.
Yes. Oh, it was such a beautiful space at Living Waters. And yeah, there's tons of props and different things that I use to help, people experience their bodies in a different way.
Right.
Sometimes simply by having a novel experience, it can change how we perceive ourselves and our place in the world. So that can be really fun and exciting. Not to say that we can't do that while we're at home.
Right.
Yeah, there's something really special about like being able to be together and to share
Yeah.
those experiences. Yeah.
I agree. So in terms of like the pelvic health and low back, can you give us one simple exercise that we can all do without having to see the person, because we're on a this is an expert talk series for my membership group, and could you provide maybe one simple exercise that can help for us to feel better if you happen to have any pelvic floor or maybe some low back issues?
Sure. So let's talk about the pelvic floor one first.
Okay.
And this is kind of typically, I guess, maybe where I might start with someone just to kind of explore and kind of start to figure out what's going on down there. Because we often don't think about our pelvic floor. We might know that there's an issue, something going on, but we have no idea. We don't really feel into that area.
Mm-hmm.
So my suggestion would to come into a seated position. So maybe sitting on a chair or bringing a pillow on the chair. So you can feel a little bit of pressure between your pelvic floor and whatever you're sitting on. If you have like yoga bolsters, you could straddle a bolster. And then, getting really quiet. Mm-hmm. So starting to maybe notice your breath. And you can take a couple of minutes just starting to feel the breath come in. And then starting to bring your attention down to your pelvic floor. Mm-hmm. And some people might be able to sense a gentle downward pressure as you inhale.
Yes.
Kind of a release of that pressure as you exhale. And so if the pelvic floor is responsive, if it's able to contract and release, you might be able to sense into that. And it might take a little bit of practice. And if you can't feel it, that's totally okay too. And so in those situations, I would say visualize the breath moving in and out of the pelvic floor as if you were breathing through your pelvic floor. Sometimes bringing your hands down even just to feel, or maybe sitting on a heating pad can bring more sensation into that area. And then I say stick with it. Like every day, spend a couple minutes and just see what you notice. And typically what I find after the third or fourth day, women start to say, oh, I'm starting to notice something now. There's a different awareness, something shifting and changing. Mm-hmm. And so that would be kind of a jumping off point. Just start to feel into the area and see what you notice.
Interesting. I've never gone through this process before. And you're right. It's like you actually do feel pressure down there that I've never, ever realized. And what we said, when you breathe in, you feel the pressure, and when you breathe out, the pressure releases. Like, oh yeah, you're right. It does. Because you don't think about that area.
Yeah, our pelvic diaphragm operates much like the diaphragm in our rib cage, and that changes our intra-abdominal pressure through our core. So in that way, our pelvic floor is very intimately linked to our core stability and our core strength. So having a well-functioning pelvic floor can make us more stable and stronger. And that's also linked to hip and low back function or hip and low back pain, because we want to have a stable pelvis, leg bones that move well in our hip sockets, and a great connection between our pelvis and our rib cage. So yeah, starting with the pelvic floor could be a starting place. It's not always a place that I go with people, depending on, you know, their life experiences and what they need.
Right.
But just, yeah, explore that and see what you notice.
Yeah, because I teach Pilates and I don't typically work the pelvic floor. Yeah, the inner core, that's what they called it in Pilates, would be like your pelvic floor, your multifidus. And well, I do work the transverse, and I don't typically work diaphragm. I mean, we do some breathing exercise, but I don't really mention the exercising or engaging the diaphragm and saying diaphragm, only because, you know, I feel like when I teach classes is people want to work out, right? They don't want to lie there and just feel their pelvic floor. Not to say that there's anything wrong with that, but I do remember one time someone says, hey, can we do the pelvic floor? And I'm like, oh yeah, of course we can. And then we did the multifidus and the pelvic floor. And I do need to incorporate that more in my Pilates class as to be more of a well-rounded class versus just like, you know, making it more of a workout, right?
Yeah, and there's depending on who your clients are and who you're working with and what they want and what you feel comfortable teaching. Like a lot of people just don't feel comfortable talking about that part of our anatomy because there can be like shame or trauma, different things wrapped up within that area. So we can we approach it gently.
Yeah, and then even when I teach and when I describe how to pull up on that pelvic floor, you know, like sometimes it's hard for me to describe that feeling, right? Without sounding, you know, somewhat vulgar. You know what I mean? Like trying to be gentle about how do I describe that feeling, right?
Yeah, and what a cue that you give might work for me, but it might not work for someone else. I've talked to, you know, pelvic floor physiotherapists where they literally have like hundreds of different cues to create the same or bring awareness to the same feeling or sensation, but different things work for different people.
Right. And I think too, the pelvic floor, I mean, because I never gave birth, I never had children, but definitely women that have had children typically have more issues down there.
Yeah.
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 All right. Awesome. And what about the low back? Would you recommend the same kind of thing, or what would you recommend?
So I certainly don't think it would hurt. But yeah, the low back situation is really curious because just because there's pain in the low back doesn't mean that's where the problem is. So it's really one of those situations where I would need to see the person and see how they're moving. A lot of times it could be something with the leg bones moving in the pelvis. It could be a relationship between the pelvis and the ribs, or maybe something's happening with the shoulders that's making up for lack of mobility further down. So it could be something below, it could be something above, or it could be a combination.
Right.
So we would explore a few different things. But maybe like what I could suggest for your folks, I'm operating on the assumption that everyone, I'm just going to go on the screen for a second, everyone would have maybe like a yoga strap or a resistance band or something like that. And so what I would suggest, and I'm going to stand up here for a second, and I'm going to tip my screen so everyone can see. I'm going to give you a little demo here.
Okay.
Take the strap and I was a little bit, my legs aren't that small. Looping it around your mid thighs.
Yeah.
And keeping your legs about hip distance apart so you can feel the strap on the outside of your legs.
Yeah.
And pressing the legs out into the strap.
Yeah.
And then just standing and holding that. So that can bring more stability through this whole area, and it helps to strengthen the outside of your legs and your bum.
Right. So it's kind of like right. So it's kind of like the glute medius, right? Is that what you're referring to?
Yeah.
Right. Yeah. So we all do have bands in some form or another. So whether it be a yoga strap or a resistance band. Yeah.
Nice. Yeah. So from my perspective, when you press your legs out into the strap, it changes how your femur articulates in the hip socket.
Yeah.
So we're changing up movement relationships here.
Mhm.
And it also changes how our feet connect with the floor. So if you're
Oh,
someone like me who has a tendency to pronate, so into the inside edges of the feet,
yeah.
when you press the thighs into the strap, it changes your experience further down. So now you're more evenly
Mm,
rounded in your feet. And
right.
you
Very
can also,
interesting.
yeah, so that's kind of just a fun little thing that you can explore and see what it does for you.
Right. And it's, I do love talking to other, you know, therapists or trainers like yourself, because I look at it from, when I saw you do that, I'm thinking, okay, glute meats, right? But I never think about the bottom of the chain with your feet. And you're like, okay, it might feel different down here. So I love that. It's a
Yeah,
whole
we're just
different perspective.
yeah, bringing awareness to the body in a different way. And
Yeah.
then noticing like, okay, I did that a couple times for a minute or two, and then notice what the outcome is. So you take the strap off and that's okay, what do I notice now? Do
Mhm.
my legs feel lighter? Do I feel more grounded? Has something changed maybe further up? Has my breath changed? Right?
Mm.
So we're not, going after the low back, or we're not necessarily going after the pelvic floor, but we can do different movements or stimuli, and
Mhm.
then we see what the outcome is and whether that's helpful or not helpful.
Right, right. I
Yeah.
love that. That's great. And so Lindsay here she actually doesn't live too far from me. We're in Leslieville, and she works out of a studio called Living Waters, which is basically at Queen Street East and Pape, right? Just around Pape
Yeah.
area. It's upstairs in a beautiful building. And she does some group classes in the evenings. And she also has some other events going on. Like I think you said tonight you have a restorative yoga class all over. It's all online, so it's streamed, and you have a sound bath with it. So can you tell us a little bit about tonight's event that you're hosting?
Yeah, so tonight's event's called Restorative Yoga and Sound Bath, and it's with one of my friends, Nicole Manis, who is a certified sound practitioner.
Mm-hmm.
And I will be leading a restorative class. And instead of speaking while you're in the pose, Nicole is going to be playing her sound, her crystal bowls, and creating a really beautiful soundscape. And she does a little bit of singing as well. So we're combining both of our skills to create, a really relaxing, really nourishing, really supportive environment. So you can practice at home. You can do it in bed if you want. You can have your camera on or off. It doesn't matter. So if you don't want to be seen, that's totally awesome too. And we have registration available on my website, which is lindsaykeefeyoga.ca. Registration closes at 7:30, or you can find the Eventbrite link via my Facebook page, which is Lindsay Keefe Yoga, and that closes at 8:15.
And are
And
you running this weekly or monthly? Because I have seen you do this before in the past, just so we can kind of give the ladies an idea.
yeah, so Nicole and I have done monthly sound baths with a yoga class that are 2 hours at the studio. And this is our first time doing it online. So tonight's class is a 75-minute class, and it's on a sliding scale. So you choose how much you would like to contribute. And we'll likely do it again in the future, because I think we're going to be isolated for a little bit longer yet. And um, it's just a really, really lovely offering. It's a really lovely experience. So
Yeah,
we'll
it is.
probably try to do it a little bit more on a regular basis. It just took a while to figure out with the technology and things like that.
Yes.
Yeah.
Well, thank you very much. So, ladies, so if you've never tried a sound bath, give it a try. I personally enjoy it. I remember the first time I was at a sound bath, and I did a Reiki. It was a Reiki training that I did, and she brought a sound bowl, and we're all lying down in meditation, and she started playing with her bowl, and then I was just like, what the F was that? I friggin' fell in love right away. And it's very soothing, very relaxing. And then the combination of the restorative yoga, where if you're not familiar with it, you're basically in a pose for like minutes, right?
Yeah, anywhere from like 3 minutes to 15 minutes, 20 minutes. Yeah.
It's very relaxing. So I will type out all your contact of your Facebook page and your links and whatnot. So if anybody wants to sign up for Lindsay's event for her sound and restorative yoga, maybe not today because I won't be posting it for probably a few days, but maybe the next one that they can jump on. And
Yeah, that would be amazing.
yeah, I think I'm gonna try and come tonight. And I love the fact that, can you imagine like 2 hours? Like you just lie there
Yeah, tonight's class will be 75 minutes. And we'll, yeah, because it's the first one. If we need to do it longer next time, we can.
Right.
But in the meantime, if you want to check out one of my classes, I incorporate a lot of the principles of yoga therapy into my group classes, so they're a much slower pace. And we can kind of communicate, because there's small class sizes, we can communicate during the class. You can sign up for those through my website as well and use the coupon code LKY10 to do your first class for $10.
Ooh, love it. Oh, okay, hang on, let me write this down. Remember these pens?
Oh, I love it. That's amazing. And while you're at my website, there's also a little box to sign up for my newsletter. I'm trying to put them out weekly right now, and so there's a whole bunch of free resources from my YouTube videos to content about how you can, take care of yourself at home and things like that.
Oh,
so if it's of interest, sign up for the newsletter, check out a class, or just send me a message if you have any questions or you want to learn a little bit more about yoga therapy. I can talk about it all day.
Awesome. Well, thank you so much, Lindsay. I really appreciate your time. And ladies, be sure to check out Lindsay Keefe on her Facebook page. I will include all the links and all the promo codes and what have you down below. And I'll see you guys in the next Expert Talk series. Bye for now. Thanks, Lindsay.
Thanks, Amy.